Hello everyone, welcome to IMPRINT IS. This is the IMPRINT Explain series, and today we're going to talk about the maternal mortality rate. So, why are we talking about this? So, recently, the day before yesterday, we got an article on the Hindu, right? And it talked about the fact that India's maternal mortality ratio has declined from 130 to 122, and this is from 2014 to 16 to from 2015 to 17, right? So first question is, what is maternal mortality ratio? So the maternal mortality ratio can be calculated by dividing the recorded number of maternal deaths by the total number of live births in the same period and then multiplying by 1,000. So let's say if there were 1,000 live births, right? And let's say 110 of them died. So that is the basic idea, right? Okay, into so you'll get the number, right? So obviously, as you know, there'll be a lot more. So let's say for 1 lakh births, there would be 110 deaths. That is the basic idea behind this. Okay. Now let's try to understand how this decline has happened and what are the issues. Like, look at this place. So UP and Madhya Pradesh still are the states with the worst MMR rates. And remember the case in Gorakhpur where so many children died due to lack of ventilators, right, and so on. And which are the good states which are doing well? So look at Maharashtra and Kerala, right? Karnataka, which is improving so well, and so on, right? How the change is happening in various states. Who are the most improved states, as you can see, right? So maternal death rate is declining. That's the report, right? And this good news for India, as nearly 2,000 maternal deaths have been averted per year. So now what happened was, first we had the data was 167, this declined to 130. That is the MMR, and then now it has gone to 122. Now a target figure, right, for that is the SDGs, the Sustainable Development Goals. It talks about having a MMR of 70, right? But obviously we are far, far away, and today we'll talk about why that's the case. So Karnataka has the highest, shown the highest percentage decline, right, in MMR. But sadly, Uttar Pradesh and Madhya Pradesh have shown an increase. So that tells you, we have, no domestic convergence. Different states are still having very different priorities regarding. Then why and how the government has been trying to handle it. So what do I do? Right. So government, what it has done is it has created an empowered action group, and it talks about the fact that these states, that is Bihar, Jharkhand, Madhya Pradesh, Chhattisgarh, Odisha, Rajasthan, Uttar Pradesh, Uttarakhand, and Assam. They've taken them together and try to focus that, okay, let's try to focus and reduce this. And there has been a decline from 188 to 175, right? That is a basic. On the other hand, we have Andhra, Telangana, Karnataka, Kerala, Tamil Nadu, which are in the southern states. And if you look at them, right, it was basically just 77 to 72. So they're actually near the SDG target. On the other hand, the other states, again, we are not that great. We are 93 to 90. So actually, if possible, there should be nobody dying, but the SDG target is 70. I think maybe we should even target less than 50. How is it declining? The reason is because of the various approaches that we've done. So what we've done is we focused on institutional deliveries, then we focused towards aspirational district, and we've targeted the most marginalized and vulnerable mothers. How we have done through? We've done it through LaQshya scheme, the Poshan Abhiyan, the Pathan Mantra, Surakshit Matritva Aashwasan, the Janani Shishu Suraksha Karyakram, the Janani Suraksha Yojana, the Pradhan Mantri Matru Vandana, right? All through them. Then we have also now committed to ensuring not a single mother or newborn dies until a preventable cause is there, right? If you can prevent it, we'll do it, and move towards zero preventable maternal and zero death through recently launched Surakshit Matritva Aashwasan Initiative. That is a SUMAN scheme. So that is also there. So the SUMAN scheme is one of focus. So WHO, who has had lauded India's progress in reducing the MMR, right? Saying the progress puts the country on track towards the sustainable development goal of MMR, that is 70. Then let's try to focus what is the LaQshya scheme. So LaQshya scheme basically is the labor room quality improvement initiative to improve the quality of care in the labor room, right? And maternity operation theaters in the public health facilities. It's a multi-pronged focus at right. The idea is obviously before and after the delivery, the focus is that. The idea is to reduce preventable maternal and newborn mortality, morbidity, and stillbirths, especially in the labor room. And right, so the idea is obviously no hemorrhage happens retained. There was no issue of retained placenta, preterm, preeclampsia, or eclampsia, obstetric labor, right? Sepsis, newborn asphyxia, or newborn sepsis. All these things don't occur, right? And the idea is to improve the quality of care, uh, post delivery and immediate postpartum care. So how do I stabilize and obviously effective two-way follow-up? Then to enhance satisfaction of beneficiaries visiting health facilities, and obviously the respectful provide respectful maternity care to all pregnant women attending the public health facilities. Okay, just to look at, so this is the ad which on MyGov you can find. So LaQshya stands again for Labor Room Quality Improvement Initiative. The idea is having a mobile app for saber care, mHealth tool to support health workers for managing deliveries, to improve training, post-training reinforcement, mentoring demonstration, to cover sub-district and district hospitals, to provide quality certification of labor rooms and incentive for targets. That's the idea. Now, following the healthcare facilities, obviously, government medical colleges, district equivalent health facilities have been designated, right, in this. And more than 2,000 public health facilities across the country have been identified for this. The next scheme, which obviously, which is also known as the National Nutrition Mission, more than $200 million have been taken from the World Bank for this, right? So that is something that I think all of you should know. That World Bank sponsored scheme. This is 200 million. Recently, we took a loan for this, right? Poshan Abhiyan is a flagship scheme for nutritional outcomes for children, adolescents, pregnant women, lactating mothers, right? The idea is to use a targeted approach and convergence. And the idea is Har Ghar Poshan Tyohar. That was the scheme. Baby looks really cute. So what is the basic aim here? The idea is to reducing the stunting in children from 0 to 6 years of age, 38.4 to 25%. So the idea is we reduce stunting. How do we do that? The idea is to focus on the ICDS, that is the nutrition to pregnant and lactating women, right? For children under 3 years of age. The idea is to include investments in skill and capacity of the ICDS staff, instituting mechanism for community mobilization, behavior and change communication, strengthening systems of citizen engagement, grievance redressal, establishment mobile technology based, and improving monitoring and management of services. The idea is to reach the beneficiaries for the 1,000-day critical window for nutrition impact. There's a chapter by on the economic survey on mother and child, and it talks about the fact that this first 5 years of the child are most important, and the first 1,000-day window period is most important for basically avoiding stunting or reducing your height, etc. Okay. The idea is obviously the Poshan Abhiyan will ensure convergence of all schemes and obviously give performance-based incentives to states, to various nutrition and health workers, and there will be a focus on this. The next scheme is obviously the Pradhan Mantri Matru Surakshit Abhiyan. The idea is to provide comprehensive quality antenatal care free of cost, universal to all pregnant women on the 9th of every month. So here what we did was that we felt that, okay, still it's not enough. So we thought that, okay, let's do this thing that on 9th of every month, all pregnant women have to come and obviously do this. Pradhan Mantri Modi actually introduced this on 31st, July 2016 on an episode of Man Ki Baat. The idea is to guarantee a minimum package of antenatal care to women in the second and third trimester of pregnancy or at designated government health facilities. The idea is the program provides systematic approach for engagement with private healthcare, which includes motivating private practitioners to volunteer for the campaign, developing strategies for generating awareness, and appealing to private sector, and so on. Why this Abhiyan was launched, as we already talked about, the older data we haven't got. So the MMR in 1990 was 556. This is really, really low. Now, right, now we have actually reached, as we say, 167, and even we have reduced that also. Now, So, we've realized that, we could actually decline very quickly, right? Because during 2015 and 1990, we had a decline of more than 70%. So while this has made considerable progress, you know, 44,000 women still die, and there are cases of 6.6 lakh infant deaths in the first 28 days. So can we do something about it? What are the high risk factors such as severe anemia? Right, what do we do for that? Pregnancy-induced hypertension and so on. So what are the key features? The idea is that if every female is examined by a physician and investigated at least once, right? Then obviously there would be reduction in the maternal and neonatal deaths in our country. And the antenatal checkup obviously will be provided from the private sector to supplement the effort of the government sector. A minimum package obviously would be given, right? They would be done, an ultrasound should be done on the second trimester, right? Then IFS supplements will be given, calcium supplements will be provided to all women attending the PMSMA clinics. And then obviously there would be a target group outreach as well who have not, registered for the ANCs, right? And obviously we have to focus on the high risk pregnant women. Then what are the key features? Obviously, we have decided to actually have a sticker type of concept, that green sticker for women with no risk detected and red for women with high risk. Then obviously a national portal, a mobile application, right? We also have made an I pledge for 9 Achievers Award, which will celebrate individuals and team achievements, acknowledge voluntary contributions to PMSMA in districts and states across the India. Like, obviously various radiologist physicians from the private sector are encouraged to provide voluntary services at public health facilities. Then we have the Pradhan Mantri Matru Vandana Yojana. Was a part of the NFSA, but that's the National Food Security Act, but it has now been moved to the Ministry of Women and Child Development for better implementation. So maternity benefits of 5,000 rupees will be provided in 3 installments for pregnant women and lactating mothers upon fulfillment of certain conditions. And along with Janani Suraksha Yojana, overall 6,000 rupees would be given to every female who attains. So the idea is that we give some kind of incentive there. So that's very, very interesting. Then overall, we recently started in October the Surakshit Matritva Aashwasan Initiative, the SUMAN Abhiyan. The idea is that some kind of awareness campaign about all the schemes, talk about the beneficiaries, what all things they can get through the various other schemes. So some kind of a combination, all the schemes together coming in according to this Abhiyan. So the Pradhan Mantra Surakshit Matritva Abhiyan will, in this we'll get iron folic acid supplementation, a tetanus, diphtheria, injection, and so on. Eligibility, obviously, all pregnant women, newborn up to 6 months, children will be able to avail free health services. Zero expenses, obviously, right? In these schemes, free transport to pregnant women from home to healthcare facility and drop after discharge. Pregnant women will also be able to avail a zero expensive and C section facility in case of complications at public health facilities. The scheme will also ensure zero tolerance for denial of services to such patients. Okay, so together all these schemes, so LaQshya, the SUMAN, the Poshan Abhiyan, the various other yojanas, the Janani Shishu Abhiyan, and so on, right? The idea is that maternal mortality is something that we have decided that needs to go. Thank you so much for listening. Do subscribe and like this video. Join our Telegram group for the PDF of this video. Thank you so much.